Hello everyone, welcome to Plastic Surgery Education, and today we are going to discuss some of the common queries which the patients of carpal tunnel do have. So what is carpal tunnel syndrome? Carpal tunnel is a tunnel in the wrist. It is a tunnel in the distal wrist, and below that tunnel we have the median nerve which is passing, which gets compressed, thereby leading to problems of the carpal tunnel syndrome. So what happens is that this nerve essentially supplies the thumb, index and the middle finger, and so there is tingling numbness in these fingers, and there can be loss in the grip strength, and things start to you're not able to hold them properly. There is weakening of the grip, and these are some of the common complaints of carpal tunnel syndrome. So how is it diagnosed? Carpal tunnel is essentially a clinical diagnosis, but one can get it confirmed by nerve conduction studies. So which patients are more commonly affected? Generally, females are more commonly affected with the carpal tunnel syndrome. It has got more to do with the anatomy of the carpal tunnel. It is relatively smaller in case of females as compared to males, so the chances of nerve compression are higher. And again, because of hormonal changes in pregnancy, it is more common. It is also more common in hypothyroid patients and patients with other systemic illnesses. Now, coming to the management part of it, how to manage it? Early on, we might be able to manage the carpal tunnel conservatively. We can splint the wrist at night so that because this is the movement which is likely to exacerbate the complaints of the carpal tunnel, so we can splint the wrist at night. We can give some analgesics, some anti-inflammatory drugs which can control the complaints to some extent. But if the complaints are persistent and the patient doesn't have any relief, then we might need to go in for surgery. So what exactly happens in the surgery is that carpal tunnel is opened. So this is something which is causing compression over the nerve, and the compressing part is opened up, which thereby relieves the compression and the symptoms are relieved. Now, some people ask us what happens if we don't operate. So, as I said initially, early on, it is okay if you are able to manage your complaints in a conservative fashion, that's well and good. But if you are having persistent symptoms, if the nerve compression is continuing, then it is better that you get operated, because otherwise what happens is that because of the continuing pressure over the median nerve, over a prolonged period of time, your complaints significantly keep on increasing, and the nerve anatomy of the nerve, anatomically it gets on compressing, and it even tends to get flattened to a lot of extent. So the recovery, when you operate late, the recovery is also going to be late. So if you're quite sure that your complaints are not being managed by conservative means, it is obviously a wiser choice to go in for surgical intervention. Now there are commonly two types in which surgery is done. One is endoscopic surgery and one is open surgery. Now both have got their advantages and disadvantages, and there are authors, there are surgeons which speak in favor of either or depending upon their comfort level. But just to tell you statistically, endoscopic carpal tunnel means the surgery is performed through a minimal incision. And obviously when the incision is minimal, the post-op pain and recovery is going to be minimal. That has been proved by many studies. But again, carpal tunnel endoscopic release needs some infrastructure, needs some training. So not many plastic surgeons would probably be comfortable doing endoscopic carpal tunnel release. Those who are in favor of open release tend to say that this is a relatively smaller incision. It is not a long incision as when we are doing a laparoscopic cholecystectomy or something like that. Open cholecystectomy versus laparoscopic cholecystectomy. So the incision for a carpal tunnel is I would say this long. So it is not too big, and even patients with open carpal tunnel tend to get back to work in around 7 to 10 days or so. Now, how long to heal and how long to get back to work? Generally, by around 10-12 days, sutures are removed. Every surgeon has got his own preference, but that is what is generally done. And in the post-operative period, what most surgeons do is the wrist is immobilized because there is a suture line over here. If you tend to move wrist early on in the post-operative period, it is going to give you pain. It also might delay the healing, impede the healing. Fingers and thumb are relatively kept free, so that even in the early post-operative period, you can start moving your fingers, you can start moving your thumb. The wrist splint is removed by around 10-12 days, after which you can resume your activities of daily living, driving, and all sort of stuff. And then you need to go to physiotherapy, some nerve stretching exercises, so that recovery is faster. So this was about the post-operative care and suture removal. Now coming to complications. Now every surgery has got its own set of complications, some related to anesthesia, some are general complications which are for all type of surgeries, like infection, pain, and so we won't go into those details. I'll talk about the specific complications of carpal tunnel. Now there is a nerve which goes to the thumb, which is in this track of the incision, which is very near to the carpal tunnel, which we are going to open up during surgery. So it is likely that this nerve might get damaged. So that might result in some pain or probably some weakness in the thumb movements. Then there is specific pain over this area of the suture line. So on weight bearing, when you tend to put weight on that particular area, there might be some scar tenderness, which is specific to this. But for the nerve injury, prevention is the best way. It is better to identify the nerve under magnification, under loops we identify, and try avoiding that. Sometimes it might have anomalous course. We have to be extra cautious in those cases. And the scar, if we take good care of the scar, the pain generally tends to settle down. So this was about the complications part of it. Now, do carpal tunnels recur? So yes, literature mentions of recurrence. So recurrence is a definite possibility in a very small number of patients of carpal tunnel. So if there are recurrent problems, if the symptoms recur after carpal tunnel surgery release, then we also might need to investigate it again, and redo surgery might be advisable. Now coming to the most important question, whom do you consult for a carpal tunnel? You either consult a plastic surgeon or a hand surgeon who is specifically trained in hand surgery, because I think these are the two group of surgeons who are able to tackle or able to address carpal tunnel very effectively. So I think those are the most common questions I could think of which patients of carpal tunnel syndrome do have. Thanks for watching. Take care. Thank you.